Annual Meeting. Today, our theme is based on building capacity through data quality and technology. And before I move on and introduce our session chair, Dr. Siv Silvanarode, who is the Chief of Technical Bureau, a Malaria Program Manager of the National Center for Parasitology, Entomology, and Malaria Control in Cambodia, I'd first like to thank you everyone for joining the session yesterday and participating in the breakout sessions on identifying the research priorities that are needed to support malaria elimination in our region. So before we start, I would actually like to invite you to help us a little bit further. In relation to the work that we did yesterday, we have combined a list of research priorities into a single list of about 32 questions. This list merges all the topics that have been identified in the breakout group yesterday, and we have removed any duplicates that appear in the list, and have also removed any topic that have received at least one vote or less from yesterday. So the list is about 32 questions. Please follow the QR code or the link that I believe Dr. Phone will be sharing in the chat later in a second to help vote on the list of priority topics you think should be of focus in our region right now. Please only respond to the survey once, and you may respond up to 5 times, but a minimum of once. And the survey will be open up until about 1:30 p.m. tomorrow, right before the session on the brainstorming module for the training topics. And Professor Richard will present the findings from this short survey in the session called Data to Elimination. So without further ado, I would like to invite Dr. Siv to present and start the session.
Okay, good evening. I'm Dr. Siv from the National Malaria Control Program, Cambodia. I'm pleased to be chair of this session, and also welcome everybody to join the Surveillance Sub-Technical Working Group Annual Meeting of APMEN. And the theme of this year is talking about the data to elimination. And we will prioritize the gap and in research and the capacity development for surveillance and response. And today is the day 2 of our meeting. We will focus on the building capacity for elimination through data quality and technology. And we have 2 parts of that session: the data quality and data integration. And the data quality, we discuss the challenge and barrier to ensure quality of data or surveillance response, and also identify the solution and quality of our malaria surveillance data. And the second topic, we will view on the integration, discuss on the challenge and how to integrate the surveillance data from epidemiology perspective to entomology and for data decision making. So thank you very much, and for allowing me to be chair. Next, we will have our speaker from WHO GMP to talk about the data quality assessment. Thank you. Please. I see I will invite Dr. Laura Pai. Yes.
Dr. Laura, would you like me to share your slides for you, or would you like to share the screen yourself?
I'm going to share the screen myself.
All right, I'll leave one shortly.
So I'm just figuring out what I'm doing there now with that. Share screen, here we go. Okay. Okay, can you see my screen?
Yes.
And you can hear me okay?
Yes.
Okay, great. Okay, well, some of you might have heard a presentation I did recently on the overview of the Malaria Surveillance Assessment Toolkit we've been developing at WHO. And today I'm going to provide that overview again, but I'm going to focus on the elimination module, which is more relevant to this area of the world. Okay, so just to start, so we know that, so in the global technical strategy for malaria that was published, pillar 3 was to transform malaria surveillance into a core intervention in all malaria endemic countries, and in those countries that have eliminated malaria but remain susceptible to re-establishment of transmission. And we also have this manual here, which provides information on best practices of how to build these surveillance systems. So surveillance systems should be able to accurately capture cases and deaths, collect clinical and social demographic data on these cases and deaths, and monitor implementation of interventions. In low transmission, they should be able to trigger a locally tailored response to every infection, detect outbreaks, and provide robust data for strategic and operational planning. We need surveillance assessments to assess whether systems meet these requirements and to detect the weaknesses and gaps. And in elimination settings, it's particularly important to allow countries to prepare documentation and check data quality prior to certification. We also want to develop evidence-based and prioritized recommendations for surveillance system strengthening, and then ensure that these activities are funded. Just trying to change the slide. Ah, there we go. Okay, so surveillance system is a systematic approach to measuring the performance of malaria surveillance systems and identifying and evaluating the determinants of that performance. So I'll explain a bit more about that in a second. We're recommending that all malaria endemic countries should carry out a surveillance system assessment. And in elimination settings, it's recommended where there are fewer than 100 cases. And it's especially important in the first 3 years that countries are expected to be reporting 0 cases prior to certification. These assessments should be implemented by the national malaria programs, so they are country-driven and supported by partners where necessary. They should be undertaken as part of key NMP planning milestones, such as malaria program review or national strategic plan development. And as I've mentioned, in elimination settings, they should be undertaken prior to certification, and part of the assessment for whether the program is in place to prevent re-establishment. And we're doing them because we want to provide actionable and prioritized recommendations on how to strengthen surveillance systems for malaria control and elimination. So we really want to make sure that we are sure that these systems are capturing every single case and death. This time. Okay, so we've developed a toolkit. It's a standardized malaria surveillance assessment toolkit. And we're using this to conduct comparable and replicable malaria surveillance assessments across multiple countries and within the same country over time. The two key features of this is it's based on an adaptable assessment framework. So you can choose at the beginning your assessment scope, which is either you're in a burden reduction setting or an elimination setting, or maybe both. And we're also looking at other malaria control strategies that might be implemented in the country. You can choose the indicators that are included in the assessment, and we have indicators specific to elimination. The standard package of tools include a minimum set of priority indicators, and that's so that we can generate common and consistent expected outputs. So the other strategies that we also look at are listed here, and some of these are particularly important in elimination settings, for example, whether drug-resistant surveillance is being carried out. As I've mentioned, we have priority indicators for the elimination setting itself. And we also have priority indicators for these other strategies. But the goal of looking at surveillance of these strategies is just to understand how the information is collected and if it's integrated and used alongside the case surveillance data. So we're not doing any data quality assessment as such on these strategies as we are for the case-based data. Specifically to an elimination setting. So you start to use this toolkit, you may want to select the elimination module in countries with subnational elimination goals. Case investigations and foci investigations should be activities that are routinely carried out in the country for the majority of cases. The assessment can be done nationally, or it can also be done as part of a subnational verification process. So the assessment itself can be implemented, for example, in one province. Then you could use the burden reduction module in the rest of the country, if appropriate. I don't know if you've heard of the MEAT tool. That's also a WHO tool. It's the Malaria Elimination Audit tool. And so what we're recommending is, so this tool assesses all aspects of an elimination program at a higher level. It's recommended it can be carried out annually, and it's a self-assessment. So this tool helps identify the key components of malaria elimination strategy, the elements of the plan to prevent re-establishment, and the documentation required for certification. This should be done prior to a surveillance system assessment. And the results of the MEAT tool should be used for the country to determine whether they're ready to carry out an in-depth review and data quality and surveillance. Okay, so the toolkit has 4 key objectives. So we're mainly looking at the performance of the system, looking at the surveillance system coverage, data quality, so completeness, timeliness, and concordance and consistency of data and data use. And then we want to look at what's driving that performance. So we're interested in the context and infrastructure of the surveillance system. So which health sectors are reporting, if the minimum data set is captured, the details on the information systems that are used, the available documentation and guidelines, and whether the guidelines are adhered to, and whether there's financial resources and partner support. Then we're interested in the processes and the technical aspects of surveillance, so the tools that are involved for capturing the data flow, all the way from recording to response. And then we're also interested in behavioral aspects, such as the motivation of staff, whether staff are trained and proficient, and the accountability of staff. So in an elimination setting, there are 48 priority indicators. And I've just listed here the number that are included under each of these sub-objectives. These would be the minimum you would be expected to look at. And there are 3 approaches for carrying out the surveillance system assessment. The rapid assessment includes only the priority indicators from all the 4 objectives. And it takes around 2 to 4 weeks, and most of it can be done at the national level. A comprehensive assessment, we're looking at all the indicators, so all of the optional indicators as well. 86 if you include the optional indicators. And this could take up to 12 months, or you can have something in between where you look at all the priority indicators and add some optional ones that are relevant to your country context. So to carry out this assessment, we've got 2 main methodologies. So the first is the desk review. It's carried out at the national level. We have a desk level tool that helps you to compile all your documents and data that are needed to do the assessment. And it also guides you to conduct key informant interviews with national and subnational level staff, maybe at the regional and district level. And then we have DQA tools. So I'll mention a bit more about that in a second. And then we have the survey. So this is at the service delivery level where we have a question bank. So this allows you to carry out interviews with clinic staff at the health facility, the laboratory, and also at the district level. And then we've got the DQA service delivery tool where we're looking at the data that's been reported to the national level and comparing it at the health facility level. So all of these tools are based on the indicators that you choose at the beginning. So for each indicator, there are a set of documents and data you need to collect, and there's a set of associated questions as well. So if you don't select some indicators, these will be removed automatically from the tools. Okay, so at the national level, the DQA, what you're doing is you're extracting line listed data from the national level surveillance system. So you can see this is an example of the template at the top here. It's bigger than this. But you extract the data, and then we have some key data quality checks in place to look at the completeness of variables, consistency between the variables, and over time. And then we've got dashboards for the key indicators where you can see the summary data. Some of the key indicators, just to show you, this is an example from Bhutan. This carried out a surveillance system assessment. So we've got these indicators on the time from symptom onset to health seeking, the timeliness of parasitological diagnosis, timeliness of notification, etc. And we put in the target, and then we calculate the result of these timeliness variables here. Okay, so at the service delivery DQA, we're carrying out this assessment at the health facility, the district, and the region. And we're limiting it. So in the higher burden settings, we're using a random sampling frame and to cover the entire country. But in an elimination setting, you want to limit your data quality assessment to the following strata. So active foci, residual non-active foci, areas that recently reported malaria cases, so the last 3 years, areas with malariogenic potential, non-malarious areas with large referral hospitals reporting cases, and areas bordering countries or other geographical areas with high malaria transmission. And at the service delivery level, again, we're looking at completeness of variables in the source documents. And we're looking at concordance between the national surveillance line listed data and the following. So you don't have to look at concordance between all of these. It will depend on the country context. But what would be particularly important is looking at the laboratory registers. And the purpose of this is really to make sure that we've captured every single case that's been that's either a suspect or diagnosed and treated in the country. And we want to look at the quality of data as well. So for example, whether case classification is appropriate. Okay, so to carry out this assessment, the initiation phase involves putting together your steering committee, a concept note, and defining the scope of your assessment. And for this, we've got an implementation guide that's a step-by-step guide to guide you through the entire assessment, actually. Then you move on to the data collection phase, where you do your desk review, your DQA, and your survey. Then you analyze the data, carry out some data cleaning, and analyzing the survey data, and the results are summarized in a scorecard where each indicator you assess whether it's been met or not, and you get given a score. And then at the end, the most important is to develop your recommendations, an activity plan, a technical briefing report, and a debrief presentation. And all of this should feed into your national strategic plan, or it can feed into the certification process. Okay, so just to finish, to say that we've got 5 countries that are currently piloting the tools. But we do need to identify several countries to pilot the rapid assessment and the toolkit in elimination settings, especially the DQA part. So if there are some listeners today that are keen to pilot this, so just to say we are actually digitalizing these tools. So we not only need to pilot the original tools, but we would like to pilot the interactive web app that we're developing as well. And this web app is has downloadable elements to the tools that you can take into the field or that you could use on tablets. And we've also got dashboards with summary results and a global dashboard for country comparison as well. So that should be ready to go by the end of the year. So please get in touch if you're interested, and we'll work together with the elimination unit as well to help you support this assessment. This is just the landing page that we're developing to the current app, where we'll have this global dashboard when you log in to show, but we're also going to have a series of maps so that countries can track their progress through the assessment, and also a series of maps to show which indicators have been met and not met throughout the world. So just to finish by saying thank you very much to all these partners who've contributed to the development of these tools. And that's it. Thank you.
Okay, thank you very much, Laura. We should have another speaker, Lucia, but I think that she's not around here. But we may ask her later on. But so now we can everybody can ask a question and a question to her, for Laura, please. Laura, I can have a question that does the assessment assess the quality of data, or also you assess also the quality of the system?
Both. So both. So I focused a little bit more on the DQA today and talking about the quality of the data, because obviously in elimination settings, that's very, very important. But we do look at the system itself. So we're looking at how the system is functioning, whether there's multiple systems, whether they are integrated. So that one of the indicators itself is just to look at, an information flow, and to produce an information flow diagram actually of how these systems are integrated for capturing the data. And this is to allow countries to try and streamline, and also for them to get the support to strengthen electronic systems as well. So you can use the results of this assessment to develop some recommendations and activities around strengthening electronic systems, and to get the financial and the technical support as well.
Okay, now I have see a show hand from Arantxa. Arantxa, please, can you have a question?
Thanks, Dr. Siv, and good afternoon, good evening, everybody. And thanks, Laura, for a very, really nice presentation. I had a question around the results. If you could expand a little bit on how those results will be visualized on the app, and how the information will be stored. Would we be able to go and select the different types of indicators from the different assessments, or they will be only an overview of the results? Over.
Okay, so for your country, so we're going to have different dashboards with different levels of user permissions, actually. So if you're the country doing the assessment, or you're supporting that country, the way we've set it up is that the NMP manager will give user rights to whoever is supporting the assessment. So it would be up to them how much information people see. And the country level dashboards will provide all the details that you've entered to assess each indicator. So you would have very detailed results there of information and graphics. But for the comparison between countries, there would be a dashboard just to show whether the indicator is met, partially met, or not met. So it's like a traffic light system. So it'd be green if it was met, orange partially met, and red not met. The country itself would see its overall score in each of the sub-objective areas, but everybody else would just see the met, not met. So this is how we're going to structure it. And then the maps would be based off of those tables. If a country doesn't want other people to see their results, they can opt out of sharing in the global dashboard. A reason a country might want to do that is because they might want to wait until the report has been published and approved. So they don't want other countries to see their results immediately. So we've built that delay into the system as well. It's difficult, sorry, I don't know if you can really visualize what it would be.
Okay, thank you very much, Laura, for answer all questions here. Now we saw Lucia back, so I should invite.
Oh, good.
Yeah, Lucia to provide us some note on entomology surveillance for decision making, and after that we will continue our question. Please, Lucia.
Good morning, everyone. Do you hear me?
Yes.
Perfect. Okay. Glad. My computer is facing some issues since yesterday. Okay, let me share my screen. Do you see my screen as well?
Yes.
Perfect. Okay. Thanks a lot. So thanks a lot for having me today presenting about the use of entomological surveillance data for decision making. I'll just give a very basic presentation of like the main kind of decisions that entomological surveillance data can inform, starting with a bit of an introduction on why entomological surveillance is important. So let me move there. So basically, we all know that malaria is transmitted by the bites of mosquitoes, right? By different types of mosquitoes, all belonging to the Anopheles. So each species of Anopheles has distinct behaviors, different behaviors. They do bite in different places. Some of them bite more indoors, some of them bite more outdoors. Some of them like biting at the early evening time. Some others like biting in the middle of the night. Some others like biting early in the morning. They all have also different resting behaviors. So they rest in different locations, sometimes inside of the dwellings, inside of houses, sometimes outside. They also choose different surfaces to rest. And they do have different feeding behaviors as well. So they feed on humans, and that's how they transmit malaria, but they also feed on animals. And there are some vectors that do feed on both humans and animals. So those behaviors of the vectors really do determine where these vectors are transmitting malaria. So vector control is a key tool in the prevention of malaria. I mean, there is evidence that it has the greatest contributions to malaria burden reduction in the latest years. And it makes use of these characteristics of the vectors, so their resting locations, their biting locations, their feeding locations, to reduce the ability of vectors to transmit malaria to humans. So for vector control, all of these characteristics that I mentioned are very important, because that's the opportunity to target the mosquitoes. So for example, larviciding is targeting larva stages of the mosquitoes. ITNs are targeting indoor and late night biting, or mosquitoes biting while people are actually under the net, which in many places is during the night, but it's not only. And IRS targets indoor resting vectors. So to say, the effectiveness of each of these interventions really depends on these behaviors of the mosquitoes. If most of the mosquitoes in a region or the main mosquitoes are resting indoors, IRS is going to be a good intervention. But if they are not, IRS won't be a good intervention. So, and there is one more thing, like all of these three interventions, which are so ITNs and IRS are the two vector control interventions recommended by WHO for large-scale deployment, and larvicidin is recommended as a supplementary intervention to them. They all rely on insecticides. So also the susceptibility of vectors to these insecticides used in these interventions is crucial for the interventions to actually work. So that said, how do we get to know about these vectors? How do we measure and evaluate these behaviors and characteristics of the vectors? We do that through entomological surveillance, which is the systematic collection, analysis, and interpretation of vector data. But we are just not aiming at collecting the data. The aim is to actually end up using that data to inform decisions. So it's transforming all of the mosquitoes that we are collecting into useful information for guiding malaria control and elimination programs. So these are some of the examples of programmatic needs that entomological surveillance can support. So the first one is, for example, identifying the main vectors, and those are the ones that have to be targeted by vector control interventions. And understanding them will allow us to understand when and where malaria transmission is occurring. So when and where we have to target our efforts to control malaria. Then select appropriate vector control interventions and their deployment strategies. We'll see examples of that later. Monitor and evaluate the effectiveness of these vector control interventions. They target the vectors, so we can measure things in the vectors to see if they are working as expected. Identify threats to vector control and adapt vector control interventions accordingly. So if something has changed that may be risking our vector control interventions effectiveness, monitoring the vectors will allow us to know some of these challenges and react on time. And we will see also some examples later. Investigate the causes of malaria outbreaks or unexpected patterns of transmission, or evaluate the risk of reintroduction. We have eliminated malaria already. And identify the overall threats to malaria control. So some more concrete examples of this, right? So when it comes to guiding the selection and guiding the deployment of vector control interventions, first thing we need to know is which are the main vectors. What are we targeting? We have to target the main vectors of transmission, and that's something that we can learn through entomological surveillance. To which insecticides are vector susceptible? Very important, as I said, because vector control interventions, the main ones nowadays are based on insecticides. So it's very important to know if the vectors in an area, the main vectors, are still susceptible and the interventions are therefore going to work. Then are the main vectors, for example, if we're thinking about deploying IRS, because we've got susceptible vectors to some of the good products that we can procure in countries for IRS, we need to know if these main vectors of transmission are resting indoors, because that's when they are going to die when they come in contact with IRS. And that's something that we can learn as well through entomological surveillance. Or are the main vectors biting indoors while people are in bed under the net, or hopefully under the net? So if vectors are biting when people are not under the net, for example, when they in the early evening times, when they are bathing their kids, when they are cooking, when they are doing other things, then even if people sleep under the net, there is a portion of the transmission that is still going to happen, and we have to expect that to happen, and we have to think about ways to control that portion of transmission. And then, for example, when should an intervention like IRS be deployed? So IRS specifically should be deployed just before vector abundance starts to increase. In many countries, vector abundance is seasonal, so there's vectors increasing right before the rainy season, for example, and we need to deploy IRS before that to prevent that increase in vectors. So monitoring the seasonality of vectors will allow us to really plan our interventions properly. More examples of that, for example, to investigate outbreaks and identify threats to malaria control. For example, if vectors become resistant to insecticides once an intervention based on an insecticide is in place, the effectiveness of the intervention may be compromised. So we may have to change interventions, right? So that monitoring resistance is a trigger for us to understand when we have to consider changing interventions, find another suitable vector control interventions. So has vector composition changed? Usually as the result of implementing vector control interventions, we end up killing a lot of the main vectors, and therefore others may gain more relevance. So if vector compositions are changing as a result of vector control, or changing because there is invasive vector species or new vector species coming into an area where they were not present before, then we may have to also reconsider vector control interventions. And we may have to consider where vector control may be needed in new areas, like urban areas, if we have a mosquito that very nicely adapts to urban environments. Then have vector behaviors changed, allowing them to avoid interventions? If they have, which they do sometimes as the result of the pressure we put on them with our vector control interventions, then we may consider changing or supplementing our interventions in place as well. Some other set of examples is for monitoring vector control interventions. So for example, if we want to know IRS, ITNs, and larvicidin kills mosquitoes. So if we want to know if they are effectively killing mosquitoes, we have to do entomological surveillance. And if they are not effectively killing mosquitoes, it may be a signal that something may be going wrong. Either resistance has developed, vectors have changed their behaviors, or something has happened that is reducing the effectiveness of the intervention to kill mosquitoes. Then for how long IRS continues killing mosquitoes? Very important to select IRS products that are covering the high risk period that we want to cover with IRS. And that's something that we can also monitor using entomology, not so much entomological surveillance, but entomology, some techniques. It will allow us as well to identify whether we have to improve IRS quality. If we see a very short duration of the ability of IRS to kill mosquitoes, while in other places the same product may have been working really well, it may be that we've got a problem in quality. So another question is for how long ITNs continue to kill mosquitoes. If the time is really short, we may have to see what is happening with the insecticide impregnated on the nets. It may be degrading faster. That may be because of handling practices in the community that we may consider improving. And another question could be if ITNs are actually reducing human biting, so the percentage of mosquitoes that are actually successful at feeding on humans. If they are not reducing human biting rates, which is one of the ways we can measure this, we may have to consider whether the nets in the region are damaged. We may have to rethink the frequency of ITN campaigns. We may have to assess the population use of nets. So just a few examples of how entomological surveillance can help us. So here are some of the main indicators. I won't go into them in very detail. But there is a few things that we can measure with entomological surveillance, and we have a lot of methods to measure them. So when setting up an entomological surveillance system, we really need to think about which method to use to respond to the questions we have. And the most important thing when we set up an entomological surveillance systems is to think about what programmatic needs do we have, what information do we need to know, so that we set up the system in the right way to collect that information. Here a little bit of a screenshot of guidance on how to set up entomological surveillance. Both documents are currently under the review. The manual on practical entomology goes very much in detail into different techniques and the mosquito collection methods, while the malaria surveillance and monitoring and evaluation manual that has a chapter on entomological surveillance and vector control interventions monitoring and evaluation, it tells more, is more focused on saying how to design an entomological surveillance system, what can we measure, and what is entomological surveillance useful for, which is more or less what I mentioned today. So I'll just skip that slide. So I don't want to talk more about this. I just want to say one last thing, which is that WHO has been working on developing some digital tools to collect entomological data. These tools are based on DHIS2, which is a software used in many countries right now for health surveillance, and many are using it for malaria surveillance in terms of epidemiology, cases, deaths, etc. And for those countries that do have the system, adopting these DHIS2 based tools will allow them to integrate entomological data and epidemiological data in the same place, which is very useful to be able to answer many of the questions that I just presented on the screen. So that integration has been lacking in many countries. And if you are one of the countries that doesn't have that integration and is thinking of it, and you have DHIS2, you can use this set of tools. If you don't have it, you can still use our guidance in the surveillance manual, in the malaria surveillance manual, to set up entomological surveillance or to integrate entomological surveillance in your health information management system. So this is it. I don't want to talk more. I think I'm out of time actually. So I'll stop here and take any questions.
Okay, thank you very much, Lucia, for the very important presentation. And also, I see a hand from Leo. Please go ahead for question.
Thank you so much. Hello, everyone. And thank you to Lara and Lucia for really great presentations. Even I, it's presented at a level where even I can understand it. So thank you, both ladies, for really great presentations. I'm extremely happy that we've had one presentation dealing with the epidemiological aspects, case surveillance and so on, but also the one from Lucia on the entomological vector surveillance. Because both are absolutely critical in our understanding of how to adopt an integrated, holistic approach to malaria control, elimination, etc. So, but for me, we are still operating in silos to a very large extent. There are the people that focus on case surveillance, epidemiological surveillance, and then there are there's the vector community that focuses on vector surveillance, and both do a great job. It's very critical, it's important, but the twain do not meet. And ideally, it would be great if one can bring those respective sets of data together on one platform, so you can have an integrated visualization of vector abundance, case abundance, distribution, seasonality, etc., so that you get this integrated picture of what's going on. And the ideal situation where you would have one system, say DHIS2 or whatever, that's adopted by all countries, and where you have a vector platform and an epi platform integrated on DHIS2 for integrated. That's never going to happen, because some countries have already gone a long way historically in developing their own respective surveillance systems and platforms and so on. And they're too committed down a particular path, and the system works for them, and that's great. But I want to make a very, very strong plea. I've heard it from the people at WHO, Lucia is one of them, that they have systems, entomology systems, case surveillance systems. They have the common platform, DHIS2, where these different sets of data can be integrated and assessed together. They are willing to provide these platforms free of charge and assist countries to implement that. So tomorrow there's going to be a session where we look at this, and I'm going to be making a plea that countries who are willing to pilot this integrated approach with the support from WHO, that they volunteer to do these trials. So thank you very much. Sorry I spoke so long.
Okay, thank you very much, Leo, for recommendation and also provides the input on that. I have a question to Lucia, that can you advise the countries about choosing where and how many locations should conduct for entomology surveillance?
Thanks for the question. That has been a very frequently asked question, actually. both for entomological surveillance and more specifically for the monitoring of resistance. And we've been thinking about it a lot when we were reviewing these two documents that I saw on my screen. We've been asking experts around. We've had really many discussions on it. And the conclusion is that we cannot say a number. We cannot say how many sentinel sites people need to have. We cannot, it really depends on the country. So for example, for entomological surveillance, we do it to inform vector control for real. That's the end goal. So what we are saying, and you will probably see this in the document as soon as we publish the update in the surveillance manual document, is that you have to monitor vectors in every single region where you have vector control in place or where you are considering vector control for deployment. So you're considering vector control to be implemented. In many places, there are no resources for that because entomological surveillance requires human resources, requires equipment, materials, and takes a lot of time. Facilities. So many countries can do that. They cannot do surveillance in every single operational vector control area. In those cases, we recommend to group areas based on the types of vectors, on the malaria transmission, and on the climate or environmental factors. So if we group similar regions that have similar climate, similar environmental conditions, similar agricultural practice is very important because it affects as well resistance, and similar malaria transmission patterns, we can somehow extrapolate whatever information we get in one region to the similar other ones. But it's, yeah, the number of sentinel sites that a country should aim for has been a really frequently asked question. But that's gonna be our recommendation, to think and to look at your national situation and try to monitor in as many places as you have vector control or you consider deploying vector control.
Okay, thank you very much, Lucia. We have one raised hand from Dr. Soiti and also one question in the chat box. Go ahead, Soiti. I'm not hearing you, Soiti.
Oh, yeah. So I don't know what the name is.
Okay, but not clear. Can you repeat again?
Maybe technical problem.
Okay. Go ahead.
To ask a question. Thank Gloria for your question on the
We lost Soiti, I think. Lucia, can you answer the answer from Jeffrey in the chat box?
Yeah, I'll address that one. So the first question is, what is the role of entomology, entomological surveillance in resolving and assessing residual malaria transmission? I think in assessing, there is a really big role. As I was saying, if we can monitor the behaviors of vectors, we can understand if they are managing to avoid the vector control interventions in place. So we can have really good vector control coverage in an area and still have quite a lot of malaria transmission because of the vectors, the behaviors of the specific vectors. An example of this is, imagine we have an area where we have ITNs deployed, very good coverage, very good usage, new nets. So everything is really perfect, but we are still having malaria transmission. We could use entomological surveillance to assess if we have early biting vectors, as we call them. The entomologists call them early biting vectors. This is basically vectors that are biting before people go under the net. So despite having nets in place, despite the nets working well, there may be some vectors that are biting outdoors, and therefore they are not coming into contact with the nets, they are not dying, and they are still successful at biting people. So entomological surveillance, so the collection of mosquitoes at different time intervals during the night will help us assess that case, and also assessing human behavior, which is another very important thing to measure, which I haven't mentioned in my presentation because it was very focused on mosquitoes. But assessing human behavior will also is very important to understand whether there is those humans that are outdoors at early evening times that are being bitten by the mosquitoes, right? So we can assess, as we say, we do some calculations to assess the overlap between human behaviors and mosquito behaviors to see what is the risk of malaria transmission despite very good interventions. And in terms of like what to do about it, so once we have measured it and even we know the proportion of mosquitoes biting when people are yet not under the net, what do we do? And unfortunately, there is not a lot of things we can do right now. So as I was saying, the 2 vector control interventions recommended by WHO are for larger scale deployment are ITNs and IRS, and then larviciding and house screening is recommended as a supplementary intervention to those. None of them are really just targeting the outdoor biting vectors. Larviciding, of course, can target both outdoor biting and indoor biting because we are just killing all of the vectors in a given breeding site. So that could be a way if we can know the breeding sites of the vectors that are biting early. So that requires more entomology. That requires understanding or identifying those vectors and then trying to find their larval habitats or their breeding sites. That could be an option, but we truly don't have like now a specific intervention that targets the outdoor biting or the outdoor transmission. There are a lot of things on the pipeline. I mean, WHO's role is really to assess new interventions that other researchers, private companies, consortiums, they develop, and they present the evidence to WHO, and WHO defines whether that evidence is sufficient or the impact of the intervention is sufficient for WHO to recommend it. So we do not develop interventions, but we are encouraging everyone to continue developing interventions, especially for these tricky settings like outdoor transmission.
Okay, thank you very much. We have a hand back from Soiti, and also we have a question just linked to the money from Bobby. But however, please Soiti, and please 5 minutes. We have only 5 minutes less. After that, we have a break. Thank you.
Thank you, Dr. Sil. Sorry for the internet not stable at my side. So sorry for this inconvenience. I just go straight to the point, Lucia, regarding the entomological surveillance. As you know very well that Cambodia now quite advanced in terms of moving toward malaria elimination in this region. And as part of the surveillance manual, we have case-based surveillance as well as the entomology foci investigation, surveillance and investigation. And the transmission of malaria now move quite far from the village right now, and then just go to either the edge of the mountainous forestry area or in the middle of the forest. So I just want you to shed some light in terms of the entomological surveillance in that context specific, because now we are quite tricky in terms of the transmission move quite far from the village. Then I don't know whether the surveillance how to go to perform it. And then if we collect the mosquito, we got some Anopheles, either direct, minimum maculator, whatever, or we don't get it. What does it mean in that situation? Thank you very much.
Yeah, thanks for the question. Yeah, I'm not very familiar with the situation in Cambodia, so I'll just, sorry if I don't get the context perfectly right. I think in elimination settings, there is a lot of challenges for entomological surveillance because finding enough numbers of mosquitoes to calculate many of these indicators that I was presenting before is pretty challenging. So often the best thing to do, or the main thing to do, is to try to identify the vectors that are transmitting malaria there, or identify the presence of vectors, because often even collecting infected vectors is quite complicated. So identifying the vectors present in the area, which if we are lucky, we may be able to have some information on the behavior of these vectors from other areas, because also not having enough numbers of vectors will make it complicated to evaluate their behavior. So I think the best you could do is probably to do some surveillance. I mean, you cannot do human landing catches because you may have arbovirus disease transmission. Not sure how feasible it is to actually go and set up traps, collection traps, but you could try to set up some traps, and you could try to just map the the composition, how many different vectors you have, and a little bit of the relative importance. And in terms of control, it may be hard because probably these areas don't have the houses. No? So people are not living in these areas, but they are spending time there working or something like that, which in that case, IRS won't work. And ITNs, depending if people are staying in the forest, if they are somehow sleeping somewhere where a hammock or a net could be hanged. Otherwise, personal protection could be one of the only options that you may have in those areas. But in terms of surveillance, trying to set up some traps just to identify what kind of vectors are there, maybe doing larviciding, monitoring of breeding sites to try to identify the breeding sites where the vectors are breeding, because that could be an option for controlling the vectors if you get to identify the breeding sites. But it's definitely a challenging situation. Yeah.
Okay, thank you very much, Lucia. We have some more questions in the chat, but we don't have enough time for that. But you can still answer in the chat box for hours. So now, I would like to invite everybody to turn off your camera. We want to take a photo for our souvenir, and after that, we have a break group session. Thank you.
Could you please start share screen, Marina?
Yeah, I give floor back to the admin. Please proceed on that.
Yep, we're going to move on to the breakout session. So Dr. Siv, whenever you're ready, you can introduce the session for the group.
Yeah, we have two group work of data quality and integration, and one group of talking about data quality and the other the data integration. We have three moderators of each group here, and as you see in the slide, I think that's I don't need to mention all the name, and I would like you to please proceed on the group work, please. Thank you.
Yeah, so Dr. Phone will be moving everyone into their respective groups. We will be randomly allocating non-partner countries as well as partner countries into these groups. It will be a mixed group session, and you will be randomly allocating into either data quality or data integration groups. So give us a second and we will move everyone into their respective sessions. In the meantime, I would like to encourage everyone who hasn't voted yet to also vote on the research priorities. I will share the link once again for everyone to see. Just give me a second, and Phone will be moving you into your sessions.